Welcome to the DNP Conversation, a recorded interview series featuring Doctor of Nursing Practice professionals from across the country. Our purpose is to share the amazing work of DNPs and how they're making an impact on patient, organizational, and academic outcomes. I'm Dr. Jeannie Garber, Professor of Nursing at James Madison University.
And I am Dr. Brendan Douglas, Associate Clinical Professor and DNP Program Director at Drexel University.
Today, we're talking with Dr. Cathy Jennings. Cathy received her BSN from Radford University in 1980, her MSN from Duke University in 1982, and her DNP from Case Western Reserve University in 2009. Dr. Jennings recently retired after a 38-year career as cardiac surgery clinical nurse specialist at Carilion Roanoke Memorial Hospital, a tertiary care level 1 trauma center and the flagship hospital of Carilion Clinic based in Roanoke, Virginia. She joined the cardiac surgery program when it was only 6 months old. This program now includes 5 surgeons who perform nearly 500 surgical procedures annually and also provides support for active structural heart, ECMO, and ventricular assist programs. This program is a part of the Carilion Clinic Cardiovascular Institute, which offers high-level cardiothoracic and vascular care, serving a large geographic area and multiple communities.
Hello, it's great to be here. Thanks so much for the opportunity to be here. I want to tell you a little bit about my journey as Jeannie has documented for you a little bit about where I've come from. I've been a nurse for a little over 40 years. Started out as a med-surg nurse and decided really early on that I needed to further my education in order to really explore myself a little bit what was offered to me in nursing. Nursing is just the most flexible, most amenable to any kind of vision that you have for yourself in your career, as many of you know. So I wanted to kind of find myself. At that time, there really was only a couple of ways that nurses could advance when they did not seek a provider type advancement, and that was as a head nurse or a manager of a unit or a clinical nurse specialist route. And there were very few programs in the country at that point to train clinical nurse specialists, but I found a good one. And it was a wonderful, wonderful experience for me. So I was, I think, the second clinical nurse specialist that was hired at Carilion Clinic. We now have 11 that are in all different kinds of specialties. And I'm thinking we probably have at least as many, if not more, clinical nurse specialists at our facilities as there are in any other facility in Virginia. We're really, really proud of that. One of our clinical nurse specialists is the incoming president elect of the National Association of Clinical Nurse Specialists. We're pretty proud of that. That's Dr. Phyllis Whitehead. So I came to Roanoke Memorial as a very green nurse right out of graduate school. No one really knew what to do much with a clinical nurse specialist at that time, but a lovely group of people really embraced me and allowed me to grow as I went along. And that program has changed over time. My role had changed somewhat over time to encompass a couple of other different kinds of roles. But largely the five clinical roles of the clinical nurse specialist are the ones that pretty much we highlighted. So I've been functioning in that role for many, many years. My DNP program in 2009 really changed my world and allowed me to really focus a lot more on quality and outcomes and the frontline nurses' engagement in that. So it's been a great journey.
Great. Thank you, Cathy. One of our other questions for you is, we would like for you to share the most impactful contributions you've made to the nursing practice, our nursing profession, and to the outcomes that you've been able to influence in your role.
As you know, an acute care nurse in an acute care facility for all of my years, I've never practiced anywhere else. It's been really important to me to focus in on those great frontline caregivers. And I think for many, many years, people have known how amazing nurses are. And, you know, it's been the most trusted profession for how many years, many, many years. But I think in this time of our world, with the pandemic all around us, I think that there's been a new understanding of nurses, and especially those that are at the front line and that are in direct care roles. So supporting them and helping them be able to see what their outcomes could be, can be, and are, and help them realize that has been a big part of what I've been doing in most recent years. I've been involved a lot in research and a lot in implementing evidence-based practice, a lot in quality improvement work. I found long ago that while I love influencing and impacting single patients, and that's still my first love and what I'll always go back to, implementing ways to touch a population of patients has really been important to me. And I found that I could influence and I could really make a difference and have an impact that way. I focused a lot of my career on those kind of clinical roles that are really, really important with patients. I focused a lot on individual techniques of taking care of patients. I focused a lot on building teams of like practitioners that can work together in nursing, and also interdisciplinary teams. So I think probably if I was to nail down what I hope has been my biggest impact, it would be to advance that interdisciplinary collaboration and to fully really support and back up and engage the frontline nurse.
Cathy, thank you for sharing those contributions. That's amazing. As we educate doctorally prepared nursing leaders of the future, what reflections can you offer relative to your education?
The Doctor of Nursing Practice program really opened a lot of doors for me and a lot of visions for me on what my world really could be. I worked as a clinical nurse specialist for nearly 25 years before I embarked on a DNP program. And I really sought a chance to make a difference for a larger group of patients. I sought a difference to make a difference for more nursing staff, and I sought a way to bring people together in a collaborative manner, working towards similar goals. And although I feel like we've done that really well, excuse me, for many years, there's always room to grow there. And I felt like that was something that I could really impact. I know that there are many folks that go to DNP programs who are amazing leaders, and they desire to develop their leadership skills. You will find that in a good DNP program. You'll find that. For those that are interested in supervisory or supportive roles, project roles, project management roles, quality-based roles, you'll find that in that kind of program. You'll also find an ability for those of us that are very, very clinically direct patient care based to find a role there, and to find some really amazing everyday assists to help you be able to really further nursing and really bring that part of what I would really call bolstering nursing and bringing nursing care into the forefront of care and assuring that it's always excellent. So I think DNP programs offer across the board whatever you're looking for. And I have colleagues who have been nurse practitioner providers, who have been nurse administrators and supervisors, who have been clinical nurse specialists, who have been staff nurses, frontline caregivers, who have all found something really valuable in a DNP preparation. And for me, it really made a difference for the last at least 12, 13 years of my career.
Thank you, Dr. Jennings.
Thank you. The next question we have for you is, what do you see as the most important competency for DNP leaders as we embrace the future of healthcare?
It is a terrifically difficult question because I really am quite torn on there's so many good competencies for DNP nurses and so many solid rocks on which we're really building our practices. It's really almost impossible for me to choose one. I kind of narrow it down to probably two. The first one being to advance clinical nursing practice. I mean, that's a big thing, and to assure that advanced practice practitioners are there supporting our staff and their ability to practice every day. But right behind it, a very, very close second, is going to be to really foster interprofessional collaboration and improving patients and populations' health outcomes. I feel like where I've been able to make the biggest impact, and what I've tried really hard to do in my career, is to assure and confirm and make sure that our frontline staff really understand the importance of their engagement and quality. And I feel like I've been really successful with that. Really proud of the work that we've been able to do. We're a 4-time magnet designated facility. And I'm really proud of the fact that we're able to engage those folks so that they understand what their day-to-day care really contributes, both with an individual patient and with groups of patients, large groups of patients, and how important that is. And that our staff are aware of those outcomes. They're aware of what contributes to those outcomes, what deters those outcomes, what gives us negative outcomes. And I think that involving the whole team, we have so many more experts than we had when I started in nursing. We had some other ancillary services there that were very, very good, but now we have tremendous numbers of those folks there to support us and to really provide excellent input into the care that we're giving. And together we're just better. We're just really a better, more solid group of professionals, and patients can feel it. They can tell. And they have on a daily basis let us know how important each piece of that cog of that wheel really is. And nursing, although I think really drives all this, the interdisciplinary collaboration for me, I think is really high up. So hard to pick one, Jeannie, but two I can really rely solidly on. The others are great, but those two are my favorites.
Thank you so much, Cathy, for sharing your answers to our questions. I know that the contributions that you made over your career are numerous compared to the few that you've been able to share with us in just a few minutes. So we can't thank you enough. And Brenda is going to finish up our conversation for today.
Thank you, Dr. Jennings, so much for joining our conversation today. And thank you for the listeners. DNPs across the country are making significant contributions to the health of our communities, to the leadership of healthcare organizations, and to our academic institutions. Now more than ever, it is imperative that we continue the dialogue about what we do, how we do it, and the successes we experience. It is our hope that these conversations fuel and inspire you. Let's keep the conversation going, and thank you for joining us today. Until next time.
Thank you. Bye-bye.